Dr. Colm Henry, Chief Clinical Officer with the HSE. Is Ciara right? Do we need a date? Is there a lack of communications? Are people losing confidence with the government, with the HSE, with NPHET?
Well, Shane, thank you for having me in the programme. It is a very frustrating time, there's no doubt about that. It's disheartening to see those figures go up again. I think 760 or so last night. We're not really seeing the dip we really hoped for. We were talking only a month ago of getting down to by the end of February to 200 or so cases a day. We find ourselves stuck at this 500, even higher cases per day. It is disheartening, but we're not back to square one. It is always important to focus on what's positive here. And what we're seeing now in the vaccine programme, and I'll go into Ciara's point in a second if that's okay, is we're seeing the nursing home residents and staff almost completely covered, and that in itself is a huge achievement in protecting those people against who are perhaps the most vulnerable section of our population. And we're seeing frontline healthcare workers again more or less covered dose 1 well into dose 2, and of course those figures among acute hospital healthcare workers have collapsed from 1,000 per week in mid-January to now in the most recent in a couple of weeks ago to 14 in 1 week. So there's much to be positive about too, Shane, and I'm looking this morning, the nursing homes beginning to ease restrictions, and maybe that's the beginning of the journey that Ciara and many others are asking for. Yeah,
lots to be positive there, but Ciara's point, and lots of people texting in agreeing with it, saying we need a pathway. We need to know at what point we can at least begin to hope that things will begin to open up, and we're seeing a breakdown in communication. We're not getting that pathway. What would you say to that argument?
Well, to look specifically at Ciara's point there about the purpose of vaccination programme, the first purpose of this particular any vaccination programme, but particularly this one, which is unprecedented in scale and the amount of people and a number of vaccines and all those different target groups, is to reduce illness, to reduce serious illness, to reduce hospitalisations, reduce death among the most vulnerable groups. In other words, to give that individual protection to those people who've most to fear from this virus. And it's beginning to do that, not just here, but more pointedly abroad, where in countries which are further down their pathway of vaccination. So there is considerable hope for older people, for people with chronic disease, for people coming into hospital with reduced outbreaks and reduced cases and reduced sickness, and there's no doubt about that. The second purpose of vaccination programme is you aim to cover a critical proportion of the population so that you can say then that you've got this thing we all hope for, which is called herd immunity. Now, it's worth noting what the WHO rep for Europe said, Hans Kluge said at the weekend. He said the vaccine does not replace, but enhances public health measures, and it's too early to assume that increased vaccination uptake will immediately lead to an improving situation with the virus. Of course, there are some pointers there. We've lots of studies coming out now showing markers of reduced transmission, but it's too early. Now, this isn't from me, this is from the WHO to say that we can start releasing all the other elements of public health control and rely purely on vaccine alone.
At the moment, as numbers stand, and I mean, look, I'm not a modeller, but I don't think you need to be a modeller to kind of predict that the numbers are going to climb over the next week or so because of, St. Patrick's Day, Mother's Day and so on, and the trend that's there at the moment. But as things stand, can we even talk about reopening the economy on April the 5th?
Well, there's always a decision for government. What I would say is we've always known that the lower we get the figures down, the more choices we have. And at 500 or 600 cases a day, it considerably narrows our choices because we know that there's lots of disease out there. There's lots of cases out there. And all those 500 or 600 cases, so much of those, about 50, 60 will translate into hospital admissions, and 5 or 6 of those will end up entering intensive care. And that's what we're seeing. We're seeing ongoing admissions of 20 or 30 per day into our hospital system. That's what concerns me in the HSE, is that it's not just a number of cases out there in the community, it's the ongoing illness that comes out of that. And it's too early in the vaccination programme to say that we've protected not just the vulnerable and the old, but the other people who come into hospitals, namely younger people, middle-aged people, and they don't just come into hospitals, they end up in ITUs as well.